The next step in your resistance training program is mobility. And what we define mobility as is optimal joint range of motion. And so what we do is we clean the tissue up. Then now, since there's no knots in it and the muscle has a little more elasticity in it, it's been hydrated, it's ready to go. It's like Kobe beef. So we versus like beef jerky. We got it, so then we go ahead and start stretching it. But we don't want to just stretch it willy-nilly, or we don't want to stretch it in a way that overdoes joint range of motion. We want to find that optimal joint range of motion. So not everyone needs mobility work. Most people do, but there's certain joints that often we see get tight in people, and that's what we're going to go after. The reason why you want that joint mobility or that mobility work is because all your joints have little sensors in it. And if you don't have the optimal joint range of motion, then your brain's not going to be getting all the signals that it needs to make a good movement strategy. That's why mobility work is so important, but most people miss that first step in cleaning up the tissues. So they might be trying to stretch something, but they end up stretching something that doesn't need to be stretched. So that's why we like to isolate it with doing a little foam roller work. That's the reason why we like to do a little foam roller. That's the reason why we like to do a little foam roller work first, or tissue hygiene, and then we could go in and do the stretches and target what needs to be stretched. Another reason why we want to do some mobility work is because most people get tight in specific areas from sitting or from doing certain movement patterns. So we want to target that because those muscles will get tighter, and then your alignment gets worse, and then you set yourself for not only bad movement patterns, but also injury, joint problem. Even your digestion will be affected, and your circulation will be affected. So if you want to move well, feel great, and perform better every year, you have to do your mobility work. So what we want to do is show you some of the general tight spots that people have on their bodies, and we'll have you do those mobility drills. We want you to hold each mobility drill for anywhere from 30 to a minute, even 90 seconds is fine, but really focusing on your proper body positioning and also your breath. And a lot of people, when they're doing their mobility drills, they're kind of holding the breath. What we want you to do is really work on and focusing on your breathing. Thank you. Have a slight arch in your low back. Rotate your palms so that they're facing the ceiling. And chin to your Adam's apple. If you have numbness in your hands, stop immediately, and you could roll side to side to open up your pecs. Place your hands on your stomach and breathe in. Be aware of your upper chest and do not let it rise. You could put your hands on your flanks, and as you're breathing in, try to get 360 degrees of expansion in your lower abdominal and rib cage area. Now that you've practiced your breathing, you can bring your legs up and keep your spine nice and long and tall, shoulders out of the ears, chin to the Adam's apple, and working your breathing. Maintain a slight hollow in your low back and a tall spine. If your knees or hips are too tight, you could grab beneath or behind the knees, and you should be feeling this stretching in the hips. Cup your feet and grab your rib cage. Exhale and try to flush your rib cage against your lower abdominal wall. Feel the stretch in your pec and slowly work on your breathing. Have your legs at 90 degrees to the wall. Make sure your butt is all the way against the wall with a small hollow underneath your spine. Reach over your head and slowly let your arms go over your head and keep your chin to the Adam's apple. Have your fingers facing all the way backwards at 12 o'clock and your feet at 12 o'clock. Lift your chest up and maintain a nice tall spine
Don't let your chin poke forward, and stretch through the arms, the chest, and the biceps. Grab one foot with the opposite hand. Tuck your tail underneath you, or posterior tilt, pelvic tilt. Maintain a level belt line. Don't let the hip kick out. If you want to increase the stretch, you could lift the arm up. If your quadricep is too tight, you could put a block or a pillow underneath, but make sure you tuck the pelvis underneath you, level the pelvis, and get into that stretch. Have your legs at a 90-90 degrees. Rotate your belt buckle towards the back leg. You should feel it in the upper back part of the hip. Maintain a tall spine, and you could use the back hand to prop you up. Do not let the spine laterally flex or allow your body to go in a C shape. Keep your feet in the same spot as you're rotating from side to side. If you want, you could put your hands behind you to support your weight. Maintain a tall spine. This should not be hurting your knees or your back. Try to work up into not using your hands at all.